Every day, British farming is facing new challenges. At AHDB, we're here to help. We invest in your future by delivering work that moves our industry forward. We're here to fund research, share knowledge, and grow markets. But it's time for a fresh start and a more open conversation. We need your voice on how we spend your levy. In April 2022, you'll get the chance to help set the direction for AHDB. Register before 31st of March, and together we can shape the future of British farming.
Good evening, everyone, and welcome to this AHDB webinar discussing best use of vaccinations in the suckler herd. My name is Sarah Pick and I work in the Beef and Lamb Knowledge Exchange team at AHDB. I'm delighted to be joined by Neil Eastham of Bishopton Farm Vets. Neil is here to talk to us about vaccination use in the suckler herd. At times, it can often be quite confusing which vaccinations are a priority and when should I be administering them are just some of the questions that I have. And Neil is here to address them all. But before I hand over to Neil, I just wanted to run through the technology so that you know how to ask questions. So if you can't see the question box at the moment, you will need to press the orange arrow button, which is essentially a minimising button. So click on that arrow and it will expand your toolbar options. Then if you click where it says questions and click on the down arrow next to it, you should be able to see where you can type your question in and remember to press send. I will then read out all of your questions at the end of Neil's presentation. So please make sure you keep sending them in. Hopefully by now you will be aware of the AHDB Shape the Future vote. In April 2022, all levy payers will be able to vote on the things your levy is spent on. It's your opportunity to tell us what you think are the biggest challenges for your sector and how you would like your levy spending. To be able to vote, you first need to register. Registration is open, but closes on the 31st of March. So please make sure you do that as soon as possible because we have a limited time for you to register. You can register by visiting the AHDB website. As a levy payer myself, I really do recommend you take the time to have your say. Because after all, it's your money, so it's really important to have a say on how it's spent. The link to register for the vote has just been put in the chat, so whilst I'm gathering on, you can be doing that. So, I'm now going to hand over to Neil, who is going to chat to us for the next 30 minutes or so about vaccination use in the suckler herd. Neil was brought up on a dairy and beef farm in Lancashire and went on to study veterinary medicine at Liverpool University. Neil is actively involved in the delivery of Bishopton's dairy, beef and sheep health schemes and has a particular interest in fertility and genetics, which led him to apply for a Nuffield Farming Scholarship in 2018. So, without further ado, I will hand over to Neil. But please do make sure you keep sending in your questions. Thanks, Neil.
Thank you, Sarah. Good evening, everyone. I'm delighted to join you this evening. A big thanks to AHDB for asking me along to talk. Myself and everyone here at Bishopton and Raft are huge supporters of the Maternal Matters campaign, and I'm chuffed to pieces to play a very, very small part in the delivery of that campaign. So vaccination use in the suckler herd, what, where, when? Well, I'm pretty sure that there's going to be lots of you on the call this evening that found yourselves asking the question, is vaccination worth the cost and the effort? Now, I vehemently believe that it is worth the cost and the effort. Vaccines are considered amongst the most cost-effective ways to prevent both morbidity and mortality from infectious disease. And with this in mind, they can play a really, really important role in helping suckler herds to optimize performance and hit some of these key KPIs that we absolutely know are linked to maximal productivity and profitability. Now, it's fair to say that vaccines have hit the headlines in the last couple of years, but in truth, there's nothing new about vaccines. They've been used in both the human and animal fields for over 200 years. And going forwards, it's likely that vaccines are going to play an even greater role, especially as we look to reduce antibiotic use and optimize use. And the advantage of vaccines over antibiotics is obviously that they're not susceptible to the resistance problems that we encounter with antibiotics. Reducing the incidence of disease and harnessing that additional efficiency that goes with that will also play a huge role in improving sustainability of the beef suckler sector, and it'll help us address some of those consumer and industry concerns around the green credentials of beef suckler farming. And lastly, this year we're going to see the launch of the Animal Health and Welfare Pathway. And through DEFRA funding, there's going to be an opportunity to really get stuck into infectious disease monitoring on your farm, particularly focused on BVD. So how do vaccines work? Well, the immune system is basically the body's natural defense against infection. So when an animal picks up an infection from the environment, the cells of the immune system respond to try and eliminate that infection. Essentially, what vaccines do is they prepare the animal to fight the infection by imitating the infection and stimulating the immune system to develop immunity. So a vaccine is basically just a weakened or killed form of the bug, and it tricks the immune system to recognize it as a threat and develop the capacity to destroy it. And the immune system is really clever because it stores a memory of that bug, and if the animal picks up the infection in the future, the immune system will respond more quickly, and that will prevent or significantly reduce the impact of the disease. It's important to remember that vaccination is designed to prevent future disease. It will not necessarily prevent future infection because some vaccines are licensed to reduce shedding and clinical signs. So vaccines can broadly be classified into two groups. We've got the live attenuated vaccines. These are derived from disease-causing wild bacteria or viruses, and these have been weakened or attenuated in the lab. And some of these, and I'll give you an example in a minute, can be used in the face of an outbreak, with most requiring only a single dose. We've also got dead or inactivated vaccines, and these consist of killed or inactivated forms of the pathogen or their toxins, inactivated with heat, chemicals like formalin, or radiation. Now, the immune response to these vaccines is initially not as strong as it is for live vaccines, so usually we require a primary course of 2 doses. Now, there's around 40 vaccines licensed for use in cattle in the UK. Others, though, are available from overseas, but these require an import license before they can be used. So as you can imagine, veterinary practices have to have very large cold stores to accommodate all these different vaccines. When we think about determining what the best vaccination plan for your farm is, we need to think about what your goals are. Any plan should be bespoke to the individual farm, and you should involve your vet in this conversation. Perhaps you're looking to control the disease, and by control I mean reduce the severity of the disease or reduce the associated production losses. You might be looking to prevent entry of a disease onto your farm, or you might be looking to eradicate a disease from your farm. That may well be part of an accreditation process. Any successful vaccination plan, though, should include which diseases to vaccinate against, which animals will benefit from the vaccination, and when the cattle will benefit most from the protection that vaccine affords and provides. We need to focus on the diseases that represent the greatest risk on your farm, and to do that, we need to have a good look through your health and performance records, a look back to see perhaps what diagnostics have been done on your farm, post-mortems, blood work, etc. We also need to take into account what your attitude to risk is. Perhaps your farm is open and there are cattle moving on and off all the time, or you might be a closed herd that's paid a huge amount of attention to biosecurity. A young stock bleed is a really useful tool to determine what diseases might be circulating on your farm, and this involves blood sampling, sentinel groups of young stock that are over 9 months of age, somewhere between 9 and 12 months of age. These are animals that are unvaccinated, and we use them as a sentinel group to show us what's been circulating in recent months on your farm. We try and do 5 animals from each management group, and this is a really, really useful tool to work out what diseases may be present, and as a consequence, which ones we might think about vaccinating against. Something I want you guys to take home, though, is that vaccination should never be seen as a substitute for good colostrum management. And straight off the back of the HDB Colostrum is Gold campaign that ran through February, I think it's really important that we reinforce the importance of colostrum management. Calves are born with no antibodies, so they rely on passive transfer of antibodies from the cow to the calf via colostrum within those very first few hours of life. And research has demonstrated that in 1 in 7 calves, there's a complete failure of passive transfer, with 1 in 3 suckler calves not receiving enough colostrum. So when it comes down to colostrum management, it's the 3 Qs that are really important. We need to make sure that we get a good quantity of colostrum into these calves. The first feed needs to be 3 litres or 10% body weight. It needs to be given to them quickly. The gut's capacity to absorb antibodies diminishes quickly following birth. So we need to try and get that first feed in within the first couple of hours of life, certainly no later than the first 6 hours. And we need a similar size feed, a second feed within 12 to 24 hours of birth. Lastly, we need to think about colostrum quality, and we should periodically check this. Quality will fluctuate and really does depend on the cow body condition score and the pre-calving diet. We can measure quality using a colostrometer or a Brix refractometer. You can pick up a Brix refractometer off eBay really cheaply, with the target being over 22%, which equates to at least 50 grams per litre of immunoglobulins. If we start to think about some of the diseases that we can commonly vaccinate against, let's first focus on the pre-calving period. And we can vaccinate our pregnant breeding females against calf scour. And by vaccinating, what we do is to help protect the calf from diarrhea caused by rotavirus, coronavirus, and E. coli. And these are infectious diseases that can cause a severe scour in very young calves. Here's a picture of a calf that's been admitted to the practice, to the surgery, for intravenous fluid therapy. And these infections can be really aggressive and indeed fatal. But we have got some really useful vaccines in the toolkit to fight against these diseases. But the success of these vaccinations is really determined by the effectiveness of colostrum management. So it all focuses back on that last slide again, because there's little point vaccinating unless we make sure that we get the colostrum in these calves. It's also worth noting that with a couple of these vaccines and with other vaccines, they can contain mineral oil, so self-injection can be a problem, and you should seek immediate medical attention if that occurs. So just worth noting that. Clostridial disease. So Clostridia are actually the oldest known disease-causing agent affecting livestock and other species. They're not contagious, but they are highly infectious and ubiquitous worldwide. And the most common source of these is spores in the soil. Now, there's a large number of syndromes that are associated with Clostridial disease in both cattle and sheep, each with distinct risk factors, different sort of clinical signs and control. The big problem with Clostridial disease is that many of these unfortunately do result in almost certain death. So Clostridial disease is something that we can control really cost effectively. The vaccines are relatively cheap. Well, they are cheap, and they should form part of a vaccination plan on any suckler farm. In cattle, the three syndromes that are most common are probably blackleg, pulpy kidney, and Black's disease. So what does vaccination look like against Clostridial disease? Well, we need to administer a primary course of 2 doses, and that's generally required to be given 4 to 6 weeks apart. So 2 doses, 4 to 6 weeks apart. When we think about vaccinating young animals, the timing of that vaccination is influenced whether the dam is vaccinated or not, and whether she was boosted in the last throes of pregnancy in that last 8 to 2 weeks pre-calving. We'll talk about that a little later. Where there's a high risk of infection, it might be necessary to administer Clostridial vaccines more frequently, and that's something to discuss with your vet. Respiratory disease. This is one that a growing number of farmers are using vaccines against, and it's bovine respiratory disease presents a serious threat to profitability of the UK beef sector. The cost to the UK cattle industry is estimated to be around 80 million per annum, and where we find that BRD takes hold on a suckler farm, it's estimated to cost around £82 per suckler calf. So bovine respiratory disease can involve viruses, often as the primary agent, but we've also got bacteria, parasites, so lungworm and mycoplasma. And when we think about BRD, we need to think about trigger factors, because it's these trigger factors that often set off our outbreaks. And concurrent exposure to BVD is a major risk factor for BRD, and that's because of the immunosuppressive effect that BVD can have. But also, another trigger factor can be stress, perhaps the stress of weaning or environmental stress. Weather changes especially can have an effect. Mixing of animals, perhaps of different ages or where we buy new stock in. Transport is a definite trigger factor, as is handling. Poor housing and inadequate ventilation is definitely a trigger factor, as is nutritional deficiency or nutritional stress, such as that seen at weaning or when we change diets, or even when access to water is a problem or there's a trace element or mineral deficiency. A parasite burden, such as lungworm, can also be a trigger, and poor colostrum management, as I've already touched on, can be a definite trigger factor that can run for months and months. So there's a growing number of farmers looking to use vaccination to control BRD. And vaccination for BRD can play a really important role against those infectious agents that cause respiratory disease, that cause pneumonia. And what we know is that vaccination for BRD has the effect of increasing the calf's immunity so that they're better protected, but also reducing the challenge through reduced shedding. Now, there's a number of vaccines that are available, and the most appropriate vaccination protocol will depend on a number of factors, not least obviously what bugs are circulating on the farm, but also the age of the calf and how quickly protection is needed. It's really worth trying to establish protection before the calves are stressed. So in this picture, my colleague Helen, who's one of our vet techs, is administering an intranasal vaccine to a spring-born suckler calf 3 weeks before housing and weaning. And that intranasal vaccine is going to establish protection within 10 to 14 days so that when that calf is housed, we can mitigate against some of the risks of BRD. A group approach is important, and we should look to do all those calves that share a common airspace. Infectious bovine rhinotracheitis, or IBR, is a disease of the upper respiratory tract caused by a herpes virus, BHV1. It's highly contagious and it can affect cattle of all ages. And after infection, cattle can become carriers, and once they're latently infected, the disease can reactivate after periods of stress. So managing stress is important when we think about controlling IBR. So timing of stressful events such as housing and weaning are often worth reviewing. And again, concurrent exposure to BVD virus can be a trigger and is often associated with the worst outbreaks. So the clinical signs of IBR vary. Acute infection commonly causes overt symptoms such as fever, rhinitis, tracheitis, and streaming eyes, conjunctivitis. Often there'll be a cough as well. It can progress to a full-blown sort of pneumonia and ultimately death. But we also can see reproductive losses, including abortion. There's definitely a chronic sort of grumbling form as well, and that can take hold in a herd and can lead to a reduction in milk yield, fertility issues, and grumbling pneumonia problems. So there's a role for sure for vaccination in the control of IBR. And there are different vaccines that are available, and an understanding of these different vaccines is important when we think about how we use them on farm. So there are live IBR vaccines that are available, and these are especially useful in the face of an outbreak. So when presented with animals like this girl's got a fever, you can see her streaming eyes, conjunctivitis, she was coughing as we got her in the crush, she's got a snotty nose, she's dull, she's depressed and inappetent. And when we see this kind of IBR outbreak, we can use the live vaccine in the face of the outbreak to reduce shedding in those newly infected naive animals. We're also obviously going to need to treat these animals for pneumonia with antibiotics and anti-inflammatories. The live vaccine can be useful. There are also inactivated IBR vaccines that are available, and these can be used to reduce shedding by reactivated latently infected animals. When we think about IBR vaccines as well, we need to think about the marker vaccines that are available and the non-marker vaccines that are available. And the development of marker vaccines has been great because what it allows the lab to do is to distinguish between antibodies, so exposure that's raised as a consequence of marker vaccine, from the antibody that's present following challenge by the wild type virus or a non-marker vaccine. And it's important to note, and this is something that's often forgotten, is that vaccination with a marker vaccine, it won't prevent antibodies necessarily being formed against the field strain virus if challenge occurs. So herds free of IBR must pay attention to biosecurity. Now, the decision when to start vaccinating for IBR depends on an individual herd situation. We need to ascertain when animals are encountering IBR and establish protection before that happens. Probably most relevant to pedigree herds, we also need to bear in mind that vaccination and biosecurity protocols need to be carefully considered if herds are planning to breed animals or sell germplasm for export or to go into stud, because IBR vaccination can have serious consequences on our ability to do that. So it really is a case of speaking to your vet for the best advice around that and how that might affect your herd. BVD. BVD is an endemic disease that quietly costs the UK cattle industry an estimated £61 million per year through mortalities, infertility and poor performance. Clinical symptoms, signs include poor fertility, abortion, milk drop, congenital deformities and poor calf health, including that immunosuppression that I've already talked about and diarrhea. Now, when a non-pregnant susceptible animal comes into contact with BVD virus, it will become what we call transiently infected, and it will excrete the virus for 2 to 3 weeks before becoming immune. The biggest problem with BVD occurs when a pregnant naive animal comes into contact with infection. An infection of that naive pregnant cow in the first 120 days of gestation may lead to the birth of a persistently infected PI calf. And it's these PI calves that can appear completely normal, but they'll shed BVD virus throughout their lives. And if they survive to breeding age, they will always give birth to a PI, and infection therefore will roll on in the herd from generation to generation. There's a definite role for vaccination in the control of BVD, and that's because there are some highly effective vaccines available, the cornerstone of which, when it comes to vaccination, is to protect the pregnancy and to avoid the birth of these PIs. So once we've made those all-important heifer selection decisions, we've picked out our replacements, we really do need to establish vaccinal protection in these heifers before they are bred. Now, vaccination plays an essential part in BVD control, but it's not a panacea. And it's really important that if there's a suggestion that PI animals might be present on the farm or there's been BVD exposure, we really do need to do a PI hunt. So we need to bleed plenty of animals and probably do tag and test to check unborn calves to make sure we remove PI animals from the herd at the earliest opportunity. Back to vaccination, there are 2 vaccines available in the UK. One is Inactivated, and that covers type 1 BVD, which is the type that we see here in the UK. It's a primary course of 2 injections with an interval of 4 weeks. The second dose should be given no later than 4 weeks before the start of breeding gestation. The second vaccine, a newer vaccine, is a live modified vaccine, and that affords protection against both type 1 and type 2 BVD. Type 2 BVD being the one that we see in the US and in some northern territories in Europe. And that is a single shot, so the primary course is 1 vaccination to be given at least 3 weeks before gestation breeding. Leptospirosis is another disease that you should consider whether you need to vaccinate against, notably because it's a zoonotic disease, so humans can pick up the infection. It's a common infection in both dairy and beef herds, causing infertility, abortion and poor milk yield. Infection arises from contact with infected urine or the products of abortion, and co-grazing with sheep is a risk factor, as is the introduction of bought-in animals, particularly stock bulls, and access to watercourses. There's 2 lepto vaccines available in the UK. For each, the primary vaccination protocol is 2 doses with an interval of 4 to 6 weeks. It's important with Lepto that we establish when young animals are getting infected and when the main transmission season is for the herd. Traditionally, most herds vaccinate in the spring because it's thought that the springtime, early summer represents the main season for transmission of Lepto. But that might not be the case on your farm. So some diagnostics will help determine when we should start vaccination. What we should definitely do is establish vaccinal protection before breeding. And ongoing protection is provided through an annual booster. So now I'll come on to a few sort of top tips with regard to making sure your vaccination protocols are watertight and that you're getting most bang for your buck. And I guess first thing to think about is the importance of getting your timings right. So a vaccination schedule or calendar for the year should be drawn up well in advance. This is one that I've done for one of my farms, a schedule showing what vaccinations are rolled out across different age groups of animals. And we need to ensure that the vaccines are used at the correct stage of production, of the production calendar. So we talked about those vaccines that we're going to use in the potentially in the pre-calving period. It might be that we roll out the use of calf scour vaccines, perhaps we use a salmonella vaccine or we boost it with a clostridial vaccine. When it comes to pre-breeding, we're going to think about BVD, IBR and Lepto. Pre-housing weaning, we need to make sure that our calves and susceptible animals are covered for BRD. And pre-turnout, we might use lungworm vaccination, and that requires 2 doses at least 2 weeks before turnout, separated by an interval of 4 weeks. Mistiming of a primary course can render all the subsequent doses ineffective. So it's really important that we stick to the letter with the rollout of those primary courses. It's really important as well that we make sure we give our booster vaccinations in accordance with the recommendations. Don't jump the gun. Yeah, so we touched on this with Clostridial disease. To make sure that we get an optimal response in our young animals that potentially have a high level of maternally derived antibodies, antibodies that they've picked up through good colostrum management, it might be necessary for the primary vaccination course to be delayed until those maternally derived antibody levels wane. And that's the case with Clostridial disease. If mum was vaccinated in the last 8 to 2 weeks of pregnancy, whilst we can use a Clostridial vaccine in a calf from 2 weeks of age, it's wise to leave it a little longer so as to avoid those maternally derived antibodies having a potential negative effect on the efficacy of our vaccination in the calf. So we'd probably wait until the calf was around 12 weeks of age before commencing their primary course. We need to consider the animal's health status and pregnancy status. So it's probably a little surprise that sick animals are unlikely to respond effectively to a vaccine. And as a consequence, we should avoid vaccinating unhealthy stock. And there are a small number of exceptions, one of which I've alluded to with the use of IBR in live vaccine in the face of an outbreak. But on the whole, we should avoid vaccinating those unhealthy animals. It's worth noting as well that some vaccines can't be used during pregnancy due to the risk of abortion, but there are other vaccines, as we've discussed, that should only be used in pregnant animals. Don't forget the bull. We need to target vaccination well in advance of the breeding season. And we also need to remember that not all vaccines are licensed for use in breeding bulls. We should check with your vet about how and when and what with you vaccinate your stock bulls. Now, the risk in bulls, this is not often, this is often not because that we think there's going to be an adverse reaction. It's largely just because often the trial work's not been done to demonstrate that there isn't going to be a problem. So a lot of the time we can use within what's called the cascade, we can recommend the safe use of these vaccines. But it shouldn't be necessary to vaccinate bulls in the run-up to breeding, because that could theoretically pose a risk to things like semen quality. So if it can be avoided, then we should avoid vaccination during the breeding period and in the 60 days in the run-up to breeding, because that's how long sperm production takes. But we should take a risk-based management approach. And it might be that once we've discussed the scenario, that actually vaccination of the bull, the benefits of that far outweigh any negatives. So again, it's one where, you know, we need to have a good conversation around that. Read the data sheet. So the insert found in the box with the vaccine is known as the data sheet, also known as the summary of product characteristics. And this sets out the manufacturer's recommendation and provides answers to some of those frequently asked questions. For example, can multiple vaccines be administered on the same day? Now again, very little research has been done to explore the effects of administrating more than one vaccine, and that's largely down to a lack of trial work rather than the fact that we think that there'll be an adverse reaction. If you intend on giving multiple vaccines, then you know, speak to your vet first. And unless specifically mentioned on the data sheet, on no account should a vaccine or any other treatment be mixed in the same syringe. Another question might be, can a vaccine be used at a later date once reconstituted and/or broached? Well, unless specified on the data sheet, vaccines should be used on the same day as they are broached. But there are exceptions to that, so it's worth checking up on that. We need to ensure that we administer the vaccine using the correct route and site. We're going to use the data sheet to point us towards what that correct route and site is. And we need to make sure that the animal's well restrained and that access to the correct site is not impeded. Now, when we look in the abattoir, injection site lesions are a common occurrence in up to 4 to 6% of carcasses. So, you know, where possible, intramuscular injection should be administered in the lower value cuts of the neck. Needle selection is actually really important. We need to change needle frequently. For adults, we're going to use a wider, lower gauge needle, and for younger calves, we're going to use those higher gauge needles. We need to think about the length of the needle as well. So if our cows are in a relatively high BCS, we're going to need to use an 1.5 inch needle to make sure we get through the fat and actually into the muscle if it's an IM injection that we're after. And you can see there what the broad sort of recommendations are. Vaccinator guns, repeater guns can be useful. We need to make sure that the gun can deliver the correct dose of vaccine. Once we're finished using the gun, we need to clean it with warm soapy water on the outside, but we mustn't use any soap or disinfectant on the inside. We're just going to use hot water to clean that gun. And following cleaning, we need to dry it, reassemble it, and lubricating, and generally take really good care of that gun so that it doesn't become a limiting factor in the delivery of our vaccines. A focus on hygiene and cleanliness is important. If animals are soiled or if the weather's really, really inclement, it's probably advisable to delay vaccination. Soiled or very wet animals can be more prone to injection site reactions. We need to store our vaccines correctly. Proper storage and usage is essential to achieve maximal vaccine safety and efficacy. So exposing vaccines to sub-freezing temperatures is considered more detrimental than heat. That doesn't mean you can leave them on the dashboard in the Land Rover. We know that live vaccines are more sensitive to effective loss, especially at elevated temperatures. So those are the ones that don't like higher temperatures. And inactivated vaccines are more stable to moderate heat exposure, yet more sensitive to freezing. You know, for most vaccines, and check the data sheet, but for most vaccines, the recommended storage temperature is between 2 and 8. So in 2020, one of my colleagues, Rosie, she carried out a temperature logger project across 20 Bishopton farms. Those farms placed a data logger in their fridge that they use for storing vaccines. And we had some really startling results, quite worrying results really. The maximum recorded internal fridge temperature was 12 degrees and the minimum was -11.5. Over half, 55% of the fridges recorded at least one temperature above 8 degrees and 39% recorded at least one temperature below 2 degrees. 1/3 of farms had at least one temperature below freezing, which is really quite worrying. This is a set of results from a farm fridge. You note the daily dip below the lower recommended limit for a duration of approximately 4 hours. And across the project, across those 20 farms, we found that only 2 fridges stayed within the recommended 2 to 8 degrees. Cold chain management, though, doesn't start at the farm fridge. We need to think about transport between collection and the farm fridge. So when we're dishing out the vaccines, we'll often put them into freezer boxes with ice packs, and you can see here we've got it plastered with a label with sticky tape, identifying that this is something that needs to be kept cool. When out on farm, during some vaccination sessions, it might not be possible for you to keep vaccines cool if there isn't a fridge nearby. Some of these vaccination sessions can be lengthy, so you need to think about how you're going to practically keep the vaccines cool, and these little fridge bags are useful and can be reused for your sandwiches at a later date. This vaccine doesn't work. I'd be lying if I said I didn't hear that from time to time, and I think it's really important that we recognise that vaccinations are only one part of a comprehensive herd health plan. They can't compensate for poor management, such as, for example, poor colostrum management. They can't compensate for poor husbandry and unclean, filthy environment. And they're of limited use if the animals are in existing poor health. No vaccine is 100% effective, and rarely are vaccines alone the whole answer. And I think there's some lessons from COVID-19 that have demonstrated this, that are transferable to a farm setting. We really need to think about hygiene and sanitisation. We need to identify our vulnerable populations of animals. We need social distancing. We should keep stocking density in check, because that can be a major risk factor for transmission of disease. We need, especially with BRD, to think about ventilation. We need to identify sick animals early and do test and trace, do some diagnostics to isolate what bugs are involved. We need to think about quarantine of the infected with prompt and effective treatment. And also, often we can introduce the use of vaccine to help control the disease. Lastly, I just want to touch on biosecurity advice and think about the purchasing checklist. The greatest potential threat to the health of an established herd is the introduction of new animals. It's really important that you know your herd's health status, and where possible, any animals that you do buy in should definitely have an equal health status to that of your own. Ideally, though, they'd be of a higher health status. You really do need to know what you're buying. This can be potentially harder if you're buying through the mart, unless consigners are asked to publish the health status of their animals that they're consigning. Once you've purchased animals, I really do recommend that you quarantine them in a separate airspace away from other animals. This gives you an opportunity to watch closely for the signs of disease, to implement testing, treatment, and perhaps vaccination. And it's only, once we've done that we can assess and act on to reduce the risk posed by and to the purchased animals. And of course, as vets, we'll always try and not be the fomite that transmits disease between farms. This is me absolutely clotted in ruminal contents after a tricky fistula op. Really delighted that the client managed to capture this moment on camera. That's it from me. Big thanks again to HDB, and through Sarah now, I guess we'll see if there are any questions.
Thank you so much for that, Neil. That's a brilliant picture. I have to say, so thank you for sharing it. No, that was really interesting. Thanks, Neil. We do have a few questions coming in, so please do keep sending them. Let's make sure we get the most from Neil tonight. So the first question is, I have a high throughput of young stock, some for breeding and stopping on farm for about 6 months. Can you tell me which vaccines I should be using as a minimum?
A high throughput of young stock, did you say, Sarah?
Yeah, high throughput of young stock. I think some are staying for breeding and others are stopping on farm for about 6 months.
So if we're looking at a population of calves, then I think bovine respiratory disease is an important area to look at. It might be that vaccination can help control pneumonia in that age group. And then if those animals are being retained for breeding, you know, pre-breeding, we need to establish some protection for diseases like BVD, IBR, leptospirosis. It's really important that we get that protection in before we start breeding, which usually means starting, you know, vaccination from anywhere from 8 months of age, but it might be younger dependent on when the challenge is occurring on the farm. If those young stock are going outside, then I personally don't think you can beat vaccination for lungworm for peace of mind. So if those animals are going out to graze, if they're first season grazers, we can look to give them lungworm vaccination, 2 doses, 4 weeks apart, 2 weeks before we turn out. And also, you know, as I alluded to, Clostridial disease is so cheap to vaccinate against. It would be, it would be remiss of me not to recommend doing that as well.
Okay, brilliant. Thanks, Neil. And if you're buying in stock and you don't know where they've come from, you don't know the history, basically, is there any harm in vaccinating them if they'd already been vaccinated, or will it make no difference?
No, it shouldn't make any difference. It's always worth asking the question, but it's a case of being buyer aware, I guess, because you know hard evidence that they've definitely been vaccinated. Often when we're buying in young calves, we can look towards using a live vaccine intranasally to provide us quick protection against diseases like PI3 and RSV. And there's no problem giving that vaccine if they've historically been vaccinated in the past. You know, those are vaccines that we'll often use on arrival, so that we establish quick protection before we mix those stock with those that are already on the farm.
And I suppose that leads on to another question. Where do you see the benefits or disadvantages of using kind of an intranasal over an injectable? Why would you use, when would you use one over the other?
So we tend to use, an advantage of the intranasal vaccine is we can use it in very young calves and it's a single shot. So, for things like RSV and PI3, we can vaccinate from 10 days of age, and after 10 to 14 days, we've got, effective protection that's going to last for 3 months. Injectable vaccines, or dead vaccines, can be used very effectively to control respiratory disease, but usually, that involves 2 doses, 3 to 4 weeks apart typically, and protection not kicking in until 3 to 4 weeks after the second dose. We get longer protection, we get 6 months cover from a lot of those injectable respiratory vaccines, but the protection isn't as quick. So, it depends on the scenario, but often in the younger calves, we want quick acting protection.
Brilliant. So another question on BVD. Does tag and test for BVD detect PIs?
Yeah, absolutely. Tag and test does. So the protocol around that needs to be, you can either tag and test as part of your primary or secondary tag, or you can get the tertiary button tags. Get yourselves armed with the toolkit and the applicator. Take the tissue sample at the earliest opportunity. Don't forget to tag, well, you should tag all calves, even your stillborn calves. Send that off to the lab, and they will tell you whether that animal is virus positive or negative. If the animal tests positive, that doesn't always mean that that calf is a PI. What we should look to do with that calf is to isolate it and retest it in 3 weeks' time, because there's a chance that actually that calf might just be transiently infected, transiently viremic rather than persistently infected. So once 3 weeks has passed, we're going to blood sample the calf. If it comes back virus positive again, antigen positive on the blood test, then we know that that calf truly is a PI, and we need to remove that calf from the herd. And at that point, probably test the dam just to check what her status is. So tag and test a really, really effective way of screening calves and giving you confidence that those animals coming through are not persistently infected. If there's a suggestion that there's circulating BVD on the farm, though, we need to think about the animals that are on the ground at the time as well, though. And we can do pooled cohort bleeds, pool bleeds for virus to check those older animals as well. But yeah, tag and test $450 a go, so a really cost-effective way of giving you peace of mind that those animals are not PIs.
Yeah, and if you're vaccinating for BVD, but you do have a PI in the herd which you haven't found yet, by vaccinating your females, will that stop any new PIs occurring, or does it not?
We shouldn't assume that it definitely will. No vaccine is 100%. As important as establishing vaccinal protection will be, and arguably more important will be, identifying that PI or PIs and removing them from the herd. They're just a bad news story. They're shedding virus all the time, and that virus, even in a vaccinated animal, is making her immune system work at the expense of energy and effort, and that can make those even vaccinated animals more susceptible to other diseases and reproductive losses, etc. But so both are important for different reasons: vaccination and PI hunting.
Yeah. Just another question: does test and tagging calves detect BVD in the cows?
Well, a PI will always have a PI. So if we have a tag and test positive calf that retests positive on the blood 3 weeks later, then either mum is a PI or mum is fine and she just encountered the disease in the first 120 days of pregnancy when she wasn't protected. So perhaps hadn't been vaccinated or hadn't been vaccinated in accordance with the recommendation, or the challenge was just so great.
Yeah, brilliant. When introducing a new bull to a closed herd, how long would you suggest the isolation period should be, and what vaccines should be considered as a minimum?
A breeding bull, sorry, Sarah. Yeah.
Breeding bull, yeah.
Yeah, so any quarantine should last 28 days, and what that allows us to do is to look at whether the animals, what we call seroconvert for anything during that period. So if an animal arrives on farm and has been recently exposed to a disease, then if we were to test it on day one, it's not guaranteed that we would see that. But most diseases will result in the animal seroconverting within 21 to 28 days. So if we test at the end of the quarantine period, then we can determine whether the animal's been exposed to anything that might be a threat to the rest of the herd. So we can then think about what that means for that animal and how we might deal with that ahead of introducing it to the breeding females. The obvious one being BVD, because we know that when bulls are infected with BVD, it's possible that infection can take hold in the testicles, wall itself off, and be shed in the semen for a number of months. And that then could have obvious major implications on reproductive performance in our breeding cows, breeding heifers when we commence breeding. So in terms of vaccination for the bull, BVD vaccination, IBR dependent on the status of the herd, leptospirosis, those are going to be important diseases to consider, as well as Clostridial disease. But it's if possible, try and avoid the immediate run up to breeding and the breeding period. For vaccinating the bull. When we chuck our bull in with the cows, fully fertile bull has quite a job on. He's got to get 60% of those cows pregnant in the first 3 weeks, 90% pregnant in 9 weeks. If at all possible, let's make it easy for him. But as I said, it might be that if we take a risk-based management approach, actually, no, we do need to vaccinate that bull, and we'll accept, there may or may not be consequences to that. Anecdotally, a lot of these vaccines are safe to use in bulls, but it's a case of speaking to your vet just to make sure you've got a watertight plan.
Brilliant. We've just got 2 questions remaining. So the first one is, you talked about giving vaccines before start of gestation. What if your bulling period is 2 months or longer? Does that mean you have to vaccinate cows with a few different bottles of vaccine, as they might not be at the right stage for vaccination?
Yeah, so once we've administered a primary course of some of the vaccines for BVD, Lepto, IBR, often the booster needs administering within 12 months. So as long as we give that booster within 12 months, we are providing forward protection. The crucial thing with BVD vaccine, with Lepto vaccine, is we get that protection established a good few weeks, 3 to 4 weeks before the onset of breeding. That cover, though, if we've completed a primary course, will run for 12 months typically. And thereafter, we're on to just an annual booster. Now, the timing of that booster, if we're in a block calving, spring or autumn calving scenario, then we'll often find that all our animals are at the same stage in the production calendar. And once we're onto an annual booster pattern, if some of those animals haven't yet calved in, these are vaccines that are safe to use in pregnant animals. So it's important that we get that dose in within that 12-month time frame, because if we don't, then we need to recommence the primary course again.
Great, thank you. And I think this question it's just come in, and I think it's just checking somebody's understanding. So a breeding bull coming onto the farm needs to be on farm a good few months before service to allow 28-day quarantine to assess which vaccinations are needed, and then vaccinate at least 60 days before he's put in with the cows.
In an ideal world, but as I say, let's face it, sometimes we can semen test our bulls and realise at relatively short notice we've not got adequate bull power. We're going to need to rush out and buy a bull. So we need at that point to ask questions of what the disease status of that bull is. Does that bull come with any accreditation around some of those common diseases? And if it doesn't, then actually probably vaccination there and then is the lesser of the 2 evils, and we need to make a risk-based management decision around just actually cracking on and getting that done. So no, you don't have to wait that long. With any new stock, the advice is to quarantine for 28 days and to assess at the end of that period as to whether there's suggestion that there's been any exposure to disease. And at that point, then we can, during that quarantine period and at the end of the period, if we haven't mixed that animal or animals with our own stock, we can act relatively quickly to safeguard the rest of the herd.
Brilliant. I'll just check. Yes, that's all. I think there's just one final question. Now, this is a question for you, Neil. Can you recommend a fridge that you can set the temperature at? Mine is just a number on a dial. I think mine's the same. Yeah,
what I would suggest is actually, a normal sort of white fridge from a high street store is adequate. The best thing you can do is invest in a temperature logger that you can buy off the internet, just to monitor to that fridge. I'm not going to suggest you need to go and buy a really fancy, expensive, all singing, all dancing fridge. That's not necessary. A normal household sort of white fridge is adequate, but get yourself a temperature logger off eBay and just keep check of what it's running at. And by checking that regularly, you can intervene quickly if there's signs that fridge functionality is a problem. Also think about where you site the fridge. So if the fridge is in an outdoor shed that's a bit drafty, or it's cold, then at different times of the year that fridge will operate at a different temperature. So the placement of a temperature logger into the fridge allows you to just monitor that over time.
And is it right that you shouldn't store vaccines in the door because the temperature changes?
Fluctuations, yeah, shouldn't be a need to, just keep them in the main body of the fridge.
That's it. So questions just come in. Sorry, Neil. When you're vaccinating a full herd, so 180-ish animals, how often should we change needles? It's a good question.
Yeah, good question. I mean, we need to be sensible. I'm not suggesting single use at all, but I think, over time that needle will deteriorate in quality. I probably would be looking to change that needle. I've got to be pragmatic, probably be looking to change that needle every 15 to 20 animals as a minimum, really. They're inexpensive, and if you're using a vaccinated gun, they're really quick to change.
That's it. So I think that's all the questions. I don't think there's any more coming in. So thank you very much for that, Neil. I'll just wrap up. I'll share my screen again. So we have a number of technical focus booklets and tools available. These are available on the Knowledge Library part of the website. So please do go and have a look at those. So there are some, if any of you have got sheep, there is a webinar on vaccine use in sheep, and we also have a booklet on using medicines responsibly. This webinar has also been recorded and will be posted on YouTube. So if you want to watch anything again, you can do. Now, as Neil mentioned, this webinar, along with others focusing on suckling, has been brought to you as part of the Maternal Matters campaign. And this campaign aims to highlight the importance of cow performance in the suckler herd. And it's focusing on two key areas. So that's improving herd fertility and reducing age at first calving. Now we've created a website. The link is found on the slide there. And we're also hosting a number of webinars and podcasts such as this one. We also have an article in Farmers Weekly roughly every month, so please look out for those, and for any further information, go and have a look at the website. So it's my job to bring this webinar to a close. I would firstly like to say a huge thank you to Neil for presenting to us tonight, particularly when I know you were on call all last night, so didn't get much sleep. We really appreciate you being here this evening, so thank you very much. Also, a big thank you to my colleague Bryony, who has been working behind the scenes to ensure that we didn't have any technical glitches this evening. And finally, a big thank you to everyone who has been listening. I really hope you've enjoyed the conversation. When the webinar ends, you will be taken to a survey. So please, if you do have the time, please make sure you complete that. It really helps us tailor these events. So thank you again, and enjoy the rest of your evening.